I'm gonna go from forearm pronation and supination all the way down, okay? So, we're going to do a little bit more specific looking at your muscles today. What I want you to do, I'm gonna bring your arm right next to your side, and I'm gonna have you turn your palm over like this, okay? Go ahead. Now, as she completes the motion, I'm gonna give resistance. She can hold good amount. What's my grade?
4.
4, right, because I'm able to move her back. Now, if she can't move there, my gravity eliminated position's gonna put her up like this. Okay? So now what I want you to do is try and do this. Okay? Okay, so she moves this far. 2 minus, right. Now the interesting thing, when you think about that, is we measure supination and pronation like this, supination, pronation. But in this case, we're looking at the whole ability of the muscle to do the full range. So that's one place where people get a little bit confused. So when I do pronation, she's really going from supination all the way to pronation. From supination all the way to pronation versus just starting mid-position and doing half. Okay? So just kind of note that difference between range of motion, because that's another place where people often get confused. Okay, now we're going to go and look at from your, and then I would palpate the pronator on the medial aspect here of the elbow. Very high, right here. Now we're going to look at your supinator. I palpate right here. And we would go ahead and try and have you bring your palm up. Okay, go ahead and try. She can't move. Let's move you up here. Go ahead and move full range. She moves full range. I give her a little. Yep. Well, she broke. Yeah, 2 plus. Yeah. If she just gave away, it would be a 2. Yeah, great. Okay. So now let's go ahead and look at your wrist. So what I want you to do is just try and bring your wrist straight up like this, okay? Yep, go ahead. She moves partially. What's my grade? 3 minus, and we're done, right? If I had to move her in gravity eliminated, it's this simple. Just to mid-position. Okay? Then let's go ahead and do...
How do you know that's not joint rather than a matter of strength?
We would have already done her range of motion. And you're right, you would want to discern that to make sure. That's one of the reasons why I like to demonstrate the motion by going all the way through. It gives me a quick pass of range of motion check, right? Mm-hmm. So what I want you to do is bring your wrist all the way up like this. We're going to be looking at her flexor carpi radialis, the flexor carpi ulnaris, her palmaris longus, palpating right in here. Okay, go ahead and bring your wrist up. She moves full range. I give resistance. She holds normal. 5. If not, we would have just done that quarter turn. That's all it would be for the wrist. That's how easy it is. Okay, now we're going to do all these. It's kind of the same thing. Supinated for against gravity, quarter turn for gravity eliminated. We're going to look at your ability to move just the end joint down like this. Okay, go ahead and try and pull down. She moved partially. What's my grade? 3 minus. We're against gravity. If she didn't move at all, I would have moved her here. This is the flexor digitorum profundus. I can palpate the tendon here, the muscle belly deep here if I want to, but tendon's usually a little easier. Then we'll go on and look at your ability to flex your PIP joint like this, okay? I'm going to hold your other fingers straight just to help you with this. I want you just to try and bend your finger down like that, looking at the flexor digitorum superficialis. Go ahead again and hold, 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 hold. She's able to hold. Good. 4. Yeah. But if not, here's my position. I can palpate, again, the tendon, just proximal to see if there's increased tension here, or the muscle belly deep in the forearm. Actually, a little more proximal right through here. Your little finger has its own flexor, the flexor digiti minimi, located right here. So what I want you to do is just bring your little finger up like this, okay? Go ahead. Up and hold, 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 hold. She holds full strength. 5. You keep in mind these muscles are a little smaller, so you have to adjust your force. They're not going to be like manpower here. Yeah, the smaller the muscle, the less that you push. Finger add and abduction. Finger adduction, what I want you to do is pull all your fingers in towards the middle, okay? Go ahead and pull in. She completes the motion, then I give a little resistance, try and hold there. Okay, and she can hardly hold anything. This is tested in gravity eliminated. It's just too hard to make everything go against gravity. So it's going to be your judgment here. Well, 3 really. She couldn't hold anything, right? But I have to make that judgment call because these intrinsic muscles are really, really weak. So next I'm going to have you start here and then try and bring your fingers all the way out. Go ahead and try and spread all the way out. And she's able to do it, so I'm going to give her a little resistance here. So you can hold slight resistance. Yeah, probably about a 4. Yeah.
You can't do this.
That's what we basically are doing is.
But this would, well.
Yeah.
It would eliminate gravity for some of it.
Yeah, that's why the problem is. That's why we just do it from the flat position, because you can't really test them all at once. And you certainly can go back and do them individually rather than the whole group if you need to really assess which one is weak. Okay. The next one we're going to do is I want you to just bring your knuckles up like this, kind of like a claw. Testing the extensor digitorum communis. Go ahead and hold, or extensor digitorum. Hold, hold. Okay, she's able to hold pretty normally. 5. If she couldn't, that quarter turn again to mid position here. Now the next one's a little bit tricky. This is the lumbricals, and I'm going to recommend in your book just learn test 1. Don't worry about test 2. It's the one that it says is traditionally used, and it is the one that's traditionally used. So what it is you're going to go from this position, and I want you to be able to bring your fingers all the way down to this flat position. So she's doing this to this, and we'll go against gravity here. So go ahead and try and bring your fingers up straight, and then see if she can hold that without collapsing. If she's weak, just let it go, let it go. There we go. So if she went full range, she held a little and she collapsed, she would be a 3. Am I against gravity?
Yes.
Yep. She held and broke.
3.
Yeah, yeah. The gravity eliminated is just a quarter turn. Okay. Go ahead and practice, and I'll give you a quick demonstration.